If you have a health-related question, email it to our doctors and our pharmacist at greatdayhouston@khou.com. They will try to answer them during the show. When you look at the numbers, they're alarming. Nearly 25 million Americans are diabetic, and that can lead to heart disease, kidney failure, blindness, and even death. Here to help us understand what happens in the body when you're diabetic and how to know if you are at risk, please welcome back HEB pharmacist Gina Eubank. Hello there.
Hello.
Okay, so let's first start with the alarming number of people who don't even know that they're diabetic, which means that damage is going on behind the scenes.
Definitely. I mean, people can be walking around with diabetes and not be having any symptoms that really stop them in their tracks and get their attention. Yeah. And, you know, it can be as high as 1 in 4 that are walking around without diabetes. And it's really very simple because at HEB, second Saturday of every month, we have a free glucose screening and blood pressure.
Yeah, so, and that's great because a lot of us don't go to the doctor until something's wrong.
Exactly.
Or we feel like you got to make an appointment. So it's as convenient as doing your grocery shopping and then stopping by the pharmacy.
Yeah, you can be proactive and find out. We had one patient that came by and he got his blood glucose tested, which when you get your blood glucose tested with this machine over here, this yellow one, that tells you your blood glucose at that moment. Okay, that's very key. That's what people with diabetes do. They need to know after they eat something what happens.
Right.
Okay, so this gentleman, his was a little elevated, not alarmingly so. So I spoke to him. He had other risk factors. Turns out we did an A1C test. Well, an A1C test, which you can also do at HEB, evaluates your blood sugar over the past 2 to 3 months. So you can have eaten, you can have done whatever.
Yeah,
you can
just gives you a more accurate reading. Yeah.
Well, there's no way to cheat.
Yeah.
Because it tells you, you know, let's say you haven't had a donut for the past 2 days, but you ate a dozen a week ago.
Yeah.
It's going to show up. You know, you're busted.
Yeah,
you know,
yeah. But then that can tell you whether you need to take bigger action and get to a doctor and really get your prescriptions for certain things that can stop or slow it down. For some people, it may be just you're on the cusp. We need you to do some diet changes. Easier said than done for a lot of us. For others, you can take a pill, like a kind of a, different brands of metformin, glucophage, things like that. What does that do?
Okay. What those do, diabetes,
Yeah, first let's explain what diabetes does in your body. Yeah.
Diabetes, when you eat food, your body breaks it down into glucose. Okay, so you have glucose floating around, little cells. Then your pancreas over here, which this is a great graphics here, your pancreas releases a hormone. And see the little green coming out? That's insulin. Okay, so your insulin is going to grab this food when it comes down, and it's going to couple up with that food, and it's going to take the food, and it's going to take it to the cell, because the food needs insulin to get into the cell. It's like a key. Okay, so you're about to see the green lock onto the blue. Okay. That's the insulin with the food, the glucose, getting the energy into the cell. So if you have diabetes, you have the blood sugar, the glucose floating around in your cells, your blood, and it can't get in the cells and provide the
energy.
Energy, exactly. Okay. So what happens is there are 3 ways that you can have diabetes. If your pancreas isn't producing enough insulin, if it's not functioning properly, so your insulin is not functioning properly, it basically can't open the door, or if your glucose levels, if that's not properly responding to the cell. So consequently, these medications, they all work by different modalities. Like your metformin, this lowers your glucose level. It doesn't do anything with the pancreas or the insulin. Okay, then you've got these other ones here, and they work on the actual pancreas, which affects the insulin and how effective the insulin is. Then you've got the insulin if you're not producing enough insulin. So you can facilitate it that way.
Yeah, and a lot of these are, as a pharmacist, you'd like to see people take these to kind of slow down the damage of diabetes while you make some changes.
Exactly. Once you get diagnosed and find out that you have the condition, get on these medications so that way you're not doing damage to your eyes, not doing damage to your kidneys, your nerves, and then make the lifestyle changes to see if you're a candidate, where if your pancreas is functioning properly and you're obese and you're sedentary, you can take those lifestyle changes, take advantage of them, and then gradually taper off and perhaps, live a life without being on medication.
Yeah, and we're talking like, type 2 diabetes as opposed to type 1, because they both have different personalities, and you can control type 2 diabetes in most cases. The other thing that you want people to do is have a relationship with their pharmacist, because there are times when people have made those lifestyle changes. There's a gentleman I know who lost 50 pounds, and he felt horrible. He couldn't figure out why, and then we're like, well, are you still taking your insulin? Well, yeah. It's like, well, now that you've lost the weight, your body doesn't need that in that way. So if you're ever having any changes in your symptoms, we know your doctor's there, but sometimes it's easier to at least get some advice from the pharmacist.
We're a phone call away, or if you're in the grocery store, you can just swing by and you can mention to us what's going on. If you're diabetic, once again, we'll convert you to that meter. That meter's only $18, and we have other ones that are $10, and oftentimes we have free coupons going on. And,
that's awesome.
And that's how, if you're not feeling good, you can check your blood glucose. And, if you're having symptoms and you're on diabetes medication and you've lost weight, it could be your blood pressure medicine making you sick. It could, there's so many variables involved. That's why go to one pharmacy. It doesn't matter where you go. Just pick one. And it's like picking a spouse.
Yeah.
It's very important.
Just pick one at a time. Okay. Gina, thank you very much. To learn more about the free testing, you can log on to heb.com/pharmacy and find one that's near you. Thank you, Gina. Still ahead, this woman's diabetes had her using a walker. The next step is oftentimes amputations, but instead of losing her feet, she lost 50 pounds and no longer needs a walker to get around. So how did she do it? We'll tell you next.